Hey everyone, today in this video we will be discussing about the carpal tunnel syndrome. So the contents which we will be discussing here is what is carpal tunnel and the function of the median nerve, then the carpal tunnel syndrome, then what are the causes of the carpal tunnel syndrome, epidemiology, physical examination, evaluating risk and the treatment of the carpal tunnel syndrome. So first of all, what is carpal tunnel and the function of the median nerve? So, the carpal tunnel is basically a narrow tunnel which is formed by the carpal bones and the transverse carpal ligament, which is also known as a flexor retinaculum, which provides the passageway for the median nerve and other vessels and nerves. Then, median nerve basically provides the feeling, which means sensations, and the movement to the palm, thumb, index finger, middle finger, and the thumb side of the ring finger. Then this is a figure which is showing you the carpal tunnel in which the flexor retinaculum makes the superior border, then the carpal bones forms the inferior border. And here you can see that when the median nerve is compressed, then this would cause the numbness in the thumb, index finger, middle finger, and the thumb side of the ring finger. Now what is carpal tunnel syndrome? As you know that the carpal tunnel is normally narrow, so any swelling can pinch the nerve and can cause pain, numbness, tingling, or the weakness or the muscle damage in the hands and fingers. So this is known as a carpal tunnel syndrome. The pain can also radiate up the affected arm, and with the further progression, the hand weakness, decreased motor functions, coordination, clumsiness, and the thinner atrophy can occur. The carpal tunnel syndrome can be simply defined as the excessive pressure on the median nerve. Then, what are the causes of the carpal tunnel syndrome? Now, the causes of the carpal tunnel syndrome includes number 1, it can be caused by making the same hand and the wrist movement over and over. Then, it can be caused by vibrations. It can also be present congenitally if one borns with a small carpal tunnel. Then we have no such study that can give the evidence of typing on a computer, using a mouse, repeating movements while working, playing on a musical instrument, or playing sports can be a cause of the carpal tunnel syndrome. But if we are doing it repeatedly, then it can lead to the bursitis, tendonitis that can eventually lead to the symptoms of the carpal tunnel syndrome. Then other causes includes alcohol use, bone fracture, cyst, amyloidosis, in which there is abnormal accumulation of the proteins. Then we have infection, obesity, rheumatoid arthritis. Okay, then about the epidemiology of the carpal tunnel syndrome. So the carpal tunnel syndrome occurs most often in people ages 30 to 60. Then it is more common in the women than men. Then let's discuss the physical examination of the carpal tunnel syndrome. So the first test is Phelan's test or the reverse prayer test. Okay, let me just tell you the types of the test which are performed here for the physical examination. So first we have the Phelan test, then we have the reverse Phelan's, then we have the Hoffman tunnel test, then the carpal compression test, then the palpatory diagnosis. Now let's discuss them one by one. So first of all, we have the Phelan's test or the reverse prayer test. It is performed by having the patient fully flex their wrist by placing dorsal surfaces of the both hands for 1 minute. And a positive test is when the symptoms like numbness, tingling, pain are reproduced. Then we have a second test which is reverse Phelan's or the prayers test. So this test is performed by having the patient extend both of their wrist by placing palm surfaces of both hands together for 1 minute, as if praying. Again, a positive test is with the reproduction of symptoms. Okay, then although a low sensitivity and specificity, the Hoffman tunnel test is another test which is commonly performed. Now in this test, the healthcare professionals just tap immediately over the carpal tunnel to stimulate the median nerve. Like the above test, a positive test is when the symptoms are reproduced. Then the best of these include the carpal compression. Then we have another test which is a palpatory diagnosis. In this test, the healthcare provider examines the soft tissue over the median nerve for the mechanical restriction. Now, the best of these include the carpal compression test. This is done by applying the firm pressure directly over the carpal tunnel for 30 seconds. Then the test is positive when paresthesias. The test is positive when paresthesias, pain, or other symptoms are reproduced. Then for the then the test we perform for the evaluation of the risk is the square sign test. Now in the square sign test, it is basically an evaluation to determine the risk of developing the carpal tunnel syndrome. The test is positive if the ratio of the thickness of the wrist divided by the width of the wrist is greater than 7. Now, the last part is the treatment of the carpal tunnel syndrome. So, the first is the modification of activities and the workplace, task modification, for example, taking sufficient rest, and the variation of movements. Then it can also include the manual therapy techniques that includes the mobilization of soft tissue, carpal bones, median nerve. Then it can include the modalities like ultrasound and the electromagnetic field therapy and splinting. So that was all about the carpal tunnel syndrome. I hope you enjoyed the video. Thank you.